Hey, Rick Giannotta here. Today on the Healthcare Nation podcast, we go skin deep as we tackle the intersection of beauty, biology, and business. Let me start with a question. Have you ever looked in the mirror and felt your confidence shift up or down? Well, you're not alone. Skin is more than what shows. It's how we engage with the world. It's many times the first thing people see, and often the first thing we judge about ourselves. In our culture of selfies, screens, and high-definition everything, skin has become both a canvas and a currency. But let's go deeper, beneath the creams, injectables, and algorithms. Because today on the Healthcare Nation podcast, we're peeling back the layers of skin health to ask some hard questions. Why are dermatologic services still treated as elective luxuries by many insurers? What's driving the explosion of med spas, direct-to-consumer skincare brands, and aesthetic clinics backed by private equity? And why are new weight loss drugs like GLP-1s raising both hope and concern for how we treat metabolic and visible conditions alike? We'll explore the intersection of beauty, biology, and business in a conversation with one of the leading experts in the field, Dr. Zain Husain, board-certified dermatologist, longevity and aesthetics expert, and founder of Noor Dermatology. We'll dig into the science behind skin health, the psychological and social impact of appearance, and how supplements, longevity tech, and AI are reshaping not just our faces, but our future. This isn't just about dermatology. It's about what is included in our definition of healthcare. It's about identity, how it's formed, challenged, and reshaped by the mirror, the media, and the medical system alike. Whether you're a provider, a patient, or an investor, this conversation has something for you. Welcome to the Healthcare Nation podcast.
Welcome to the Healthcare Nation podcast. We're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the healthcare sector. Now your host, Rick Giannotta.
Okay, Dr. Zain Husain, welcome to the Healthcare Nation podcast. I am so glad to have you on here for so many different reasons.
Thank you for having me.
I got a lot to cover today, but I thought let's start with something, if I could characterize it like this, human. What's one patient story or moment in your journey that reminded you how much skin affects how people see themselves, how they feel about their own self-worth, how they're seen by others? It could be a health condition, et cetera. For myself, I could think of some things, but tell me about that.
Yeah, so one patient that comes to mind was this teenage patient. Had a long history of really severe cystic acne. She was bullied. She was constantly ridiculed for the way that she looked. She was depressed. She made several suicide attempts. And it was really heartbreaking hearing her history. And it all stemmed from the way that she looked, how she felt about herself, how others perceived her and actually actively bullied her. And it was after a lot of therapy, getting help and support from her parents, that she finally went to see a dermatologist, myself, to really tackle this issue because it was really having severe impact on her life. And I really, I went through all the various, treatment modalities, not only just to control the acne, but the significant scarring and pigmentary changes that have happened. And, we eventually decided on doing Accutane, and we had our psychiatrist involved, therapists involved, because, there are, potential risks.
Yeah,
exactly.
Yeah.
So it was not a straightforward case, but she did beautifully. And I just saw her confidence just skyrocket as we saw her skin clear. And by the end of her treatment, I couldn't even recognize her. She carried herself in a different way. She was just so much more confident. She was actually smiling. I didn't see her smile at all. She was like crying that first initial consult. And just to see this evolution in a 6-month span was absolutely incredible. And she finally felt empowered to really deal with some of these bullies that she had been tormented by. And, she was thinking about dropping out of high school. And, things turned around. Her grades started improving. She started becoming more social. She got a boyfriend, her first boyfriend. And I just saw the impact that this had on her life. And I could just tell in her eyes, she was so grateful. And that meant everything to me as a dermatologist, as a physician, and being able to restore that confidence from someone who wanted to take their own life. She had those, slit wrists and everything, those scars all over. And now, she was this confident, beautiful young woman who has such a bright future. And it's been probably 7 or 8 years since, we did her treatment. We did laser therapy and, treated her acne scars and pigmentation, and it was night and day. So that was probably one of the most significant patient stories I have as a dermatologist, and it's so fulfilling.
Wow, that is a powerful story. It's interesting because I said this in the intro. It really is how the mirror speaks to you when you see it, and for the young person, how much skin affects not only how you're seen by others, but how you feel yourself. And it's so important. And let's go back and stay on the skin health, really the dermatology side. I wanted to start with something you probably see every day in your practice. Perhaps not as dramatic as what you just said, but something that I think is important. What are the silent skin conditions that people wait way too long to see you for, to get treated? And what are the potential risks with that?
Yeah, one of the most common ones that I see that people really don't address is just sun damage. And the sun, as we know, the UV light is a carcinogen. It leads to changes on the DNA level. There are mutations that are occurring. And as time goes on and more exposure, we see that these cells start transforming. And as dermatologists, we can detect these. These are called actinic keratoses or precancers. However, there are a lot of cells that we have not been able to pick up on. They don't have texture changes. They don't have any symptoms yet. But if they had addressed this earlier on, we can prevent those from even forming, taking preventative measures. We can treat them earlier before they progress into skin cancers such as squamous cell carcinoma. So there's a huge population who's had a lot of sun damage, either from going to the beach without protection or going to the tanning beds. And you can see evidence of sun damage, but they don't know how dire it can be. And many of them don't seek the care of a dermatologist, and they wait until a tumor pops up. Yeah. And then I think it's too late. And then we're kind of working, from the other reverse direction, trying to solve the issues that are already solved rather than preventing.
Yeah, that's a tough one. And as speaking for myself as someone who's had that with a family member, it really could be quite devastating as well.
Absolutely.
So that is, talk about the basic elementary places to start. I also think it's important to think about how we should help, and this going to my clinical background, help patients understand skin as, if I can call it, a barometer, really, of your overall health. So, and I know you have your own podcast, Skin Side Out.
Yeah.
Thinking about the skin side out, tell us about how it can also be a barometer of other health conditions that might be underlying.
Yeah, the skin is an external manifestation of what's going on internally. And various organ systems, when in dysfunction, can lead to cutaneous signs. So for instance, one of my favorite systems to look at is the endocrine system. So when hormones are out of whack, there are imbalances. We see manifestations. So for instance, like a female patient with polycystic ovarian syndrome has hirsutism. She has hair growing in other places that shouldn't be. She is starting to lose hair in the scalp. They are getting hormonal acne on the face. Insulin resistance or prediabetes. We see something called acanthosis nigricans, where there's hyperpigmentation of certain body areas. These are all signs that there is something going on internally, and that can be sometimes our only sign before things get further more advanced. So I really do see that the skin has a lot of manifestations of internal health. Same thing with the gut. We see certain rashes with inflammatory bowel disease or celiac disease. If caught early, we can get the patient the proper treatment and reduce inflammation, reduce potential consequences such as colon cancer down the road.
Yeah, such a marker for so many things. When you think the largest organ in the body, right?
Yeah,
I mean,
it is.
it's really very, very powerful. I want you to go into your kind of memory bank. What's the most misunderstood skin condition when you think about it? And how do patients' lives change once it's properly addressed? Is it psoriasis? Is it, as you mentioned, cystic acne? What kind of conditions are out there?
Yeah, I find that acne is often misunderstood. A lot of people think it's a consequence of not being clean enough, their skin being dirty for some reason, them just being oily. But it is a very complex disease, and people don't realize that there are multiple facets to it. There is a hormonal component. There is a pore clogging component. There is an overactive sebaceous gland component. And many times, many of my diligent acne patients are using the right cleansers and they're keeping their skin properly, maintained, but they still have acne, and it's partly genetic and hormonal. And, they're often, thinking that I'm doing something wrong, and they're not doing anything wrong. It's just that, the unfortunate combination of hormones and genetics is usually the large driver for acne. And a lot of people don't understand that. Some parents bring their kids to me and they're saying, oh, my kid just doesn't wash their face, or they're using the wrong stuff. I'm like, that's not it. And then I kind of delve a little deeper. I mean, like, did you have a history of acne, husband? Yeah. And oftentimes there is a positive, family history. And people don't understand that there is a genetic component to it. And it's not something that they're doing wrong. Eating too much chocolate caused that, or eating greasy foods. That's not the case.
Yeah, and these notions still persist.
Yeah, a lot of myths.
Right? The myths are out there, and folks are going down a different path. Yeah. You touched upon this earlier, and I want to revisit it. When you think about certainly the preventative side of dermatology and the intersection with mental health, especially in teens, like the incredibly powerful story that you told about your patient. What are you seeing with that? How do you see preventive dermatology really intersecting with that?
It really depends on the dermatologist and whether they make it a priority. So for me, I do think about the preventative aspects and how it affects mental health and how it affects overall health. And especially with my younger patients, they're very impressionable. It's not easy growing up these days, just being bombarded with social media messages of how they should look. And I find that if I am able to gain their trust and instill knowledge in them that, this is how you should take care of your skin, it's not only going to help you now, but in the long run. So this is where I really talk to them about the importance of sunscreen. And sometimes I have to kind of turn the message so it's more relevant to them. Like, hey, you want to look good, right? Like, because that's a really important part of being a teenager, like social acceptance. So, wearing sunscreen is going to help your skin look better. Right. You're going to look more attractive. And they kind of resonate with that rather than me telling, oh, like 30, 40 years down the line, you might get skin cancer. Right. So if I can kind of get them to understand how to take care of their skin, knowing what signs are healthy. I love it when parents bring in their kids for full body skin exams, getting them used to that concept of prevention and surveillance, knowing what to look out for. I can educate them of what to look out for melanoma, for instance, right. How to do a self skin check in the shower so you can catch things earlier, and when to seek help. So I think that's part of the education I provide to my younger patients. And I feel like then I can be an advocate, kind of like a friend on their journey. And they really do trust me more when I kind of, take that approach, as opposed to being very pedantic, telling them what they should do and being just very not engaging to what their concerns are.
I think the whole notion of having agency over your own healthcare, if you could start the younger, the better, particularly since they're going to be looking for sources of truth online, et cetera, which is probably not always a wise direction to go if you're looking for treating, a particular condition with something that's contemporary, cutting edge, and what you need to mitigate the issue. Let me switch gears and really think a little bit now about the topic of beauty and bias, and even how that impacts, I'd call, belonging, whether it's societal, community, et cetera. When you think about how, and you just touched upon this, how body image, how self-perception is really influenced by filters, Photoshops, what we're seeing, especially as you just mentioned, younger patients, but we're bombarded with this, whether it's Instagram, TikTok. Look, I'm an older guy. I have a notion of how I was going to look when I'm older. I'm kind of hitting that mark. You're helping me, by the way, stay and look as young as I possibly can. Thank you. But what happens with this generation? And by the way, I don't think it's just limited to younger people who are getting bombarded with this and the pressures.
This has been going on for decades with the advent of Barbie and all these socialized ideals of what beauty looks like. And I think it definitely hits women more than men, but it's there for both sexes. But how women should look to be considered beautiful has been amplified with social media. Like you see all of these images constantly bombarding what's attractive, how I should look. And a lot of it's not reality. Many of these images are retouched. Filters. It's incredible what you can do with computers these days.
Those deep fakes are, they look so real.
And I feel so awful for these young girls. I'm a father of 3 young girls, and I'm constantly thinking about this. And my wife is a pediatrician too. So we're constantly kind of really building up their self-esteem and kind of letting them know that these idealized visions of beauty are not necessarily real. Some of them are not even attainable. I know like in the past few years, this poreless skin trend among Korean skincare, everyone wanted that like completely glass skin, no pores, looks flawless. Porcelain, not one, defect. And that's not possible. It's not an ideal you should try to strive for. And there are these little children, adolescents who are trying to emulate that by getting skincare that's not appropriate for their skin type, for their age, and sometimes doing more damage to their skin. And they're coming to us after they're having reactions to some of these products. These beauty stores such as Sephora, they make it very enticing. Like the colors, the strategy, like how they kind of portray their models and photos. If I were a little kid in that age, that's what I want to look like. And, I feel like a lot of people are getting their information and their knowledge about skin health from TikTok and from social media. And a lot of it is not being produced by healthcare professionals, not being produced by dermatologists. These are these skinfluencers who have no qualifications. Anybody these days can just get behind a camera and say whatever they want. And if you have a good following or some traction, people are going to listen to you, whether it's right or wrong. And there's a lot of misinformation as we see in society. So I think our role as healthcare providers is to provide the truth and try to let our patients know, what is truly a medical issue and what is truly a cosmetic issue. And there's nothing wrong with having a cosmetic issue, but it has to be within the scope of reality.
Right. Yeah. That brings me to my next question. How do you counsel? How do you guide patients who come to you with, whether it's body image stress or some level of perhaps a distorted perception of themselves that's shaped by these social media filters, if I can call it that, and even celebrity aesthetics? If they're coming to you and saying, I want to look like X, or can you do this, or I want this, almost as a demand. Are you seeing that a lot? And how do you navigate that?
Yeah, we are seeing a lot of this. And I think there is a surge of body dysmorphia. And I think it is being fueled by these images, these messages that people are seeing, the obsession with celebrities and how they look. And I do get requests from patients, hey, I want to look like X. They actually show me a picture of what they want to look like. Can you do this? And, when I kind of see these demands, and if they are totally out of whack from reality, that's a red flag for me. I can sense that they have body dysmorphia, and no matter what I do, they will never be happy. Right. And I just kind of say that I am not the right doctor for you. I don't think I can achieve what you are looking for. And I think I save myself a lot of heartache and headaches by avoiding treating these patients. And I think that's the ethical thing to do. as a physician, we take an oath, do no harm. And I feel like there are other injectors or cosmetic professionals who will treat anyone. I mean, there is a financial incentive, but that can nip you in the butt. I mean, I feel like they can be your worst nightmares. They need help. They sometimes need the help of a therapist, a psychiatrist, because the body dysmorphia can be all-encompassing for these patients.
And
they obsess over it.
That pursuit of some
a perfection.
There
is no perfection.
No end game.
There is no end game. And I feel like if you are treating that type of patient, you're doing them a disservice. And it can feed this, constant need to do more procedures. You've seen those, like, the male Ken doll and the female Barbie doll. They've done so many plastic surgeries and they're still not happy with the way that they look.
It's tragic when you think about the end point to it, because it can't, that pursuit of something that's not attainable at the cost of your physical appearance, and in many cases, even the structures. It could be destructive surgery.
And many times these people are attractive to begin with.
Right.
They didn't need anything to begin with. So it is something that is a psychiatric illness.
Let me, kind of on the same subject, but in the realm of bias in this, are there still systemic blind spots in dermatology that are out there when you think about whether it's our usual notion of ethics and equity and being able to have access for everything from skin tone, gender? What are you seeing out there with that?
Yeah, there are definitely disparities. There is a huge disparity between access to care, as we all know. I think that, minorities and other skin of color populations have less access to dermatologists or other specialists. And they are also less likely to seek care from them because they're actually not comfortable seeing most dermatologists because they don't look like them. The vast majority of dermatologists are Caucasian. That's just a matter of fact. It is changing as we are kind of progressing through time, but Caucasian male providers were initially what we saw, and now it's moving along more to female. But a lot of skin of color patients do not have access, and when they do seek care from a dermatologist, many of those dermatologists were not trained to see patients with skin of color. There are nuances, there are differences, like how a rash presents in an African American patient can be very different than how it presents in a Caucasian patient or a Hispanic patient. So many times there are misdiagnoses or they are undertreated. So we do see a lot of disparities. And I was fortunate to be trained in really diverse, multicultural cities. So I trained at Georgetown in DC. So I saw a lot of international patients. I saw a lot of skin of color, all types of patients, and different socioeconomic groups too, like very wealthy, affluent patients, and then also the indigent patients who had no access to healthcare. So I was fortunate to be able to see a whole wide spectrum of skin disease and being taught by some of my professors who specialize in skin of color. And then I also trained in Manhattan and in New York City, and we treated a lot of diverse patients. So I think that helped me on my journey as a dermatologist. And me being skin of color myself has played such a big role. Many of my patients have sought my care because they feel more comfortable seeing me.
Yeah.
They relate to me, even though we may not be of the same background. African American patients, Hispanic patients, Middle Eastern patients. I see a lot of these people traveling from miles away from, like Western and Eastern North Carolina to other states that are looking for someone who can help them.
It's interesting because I really think, look, the access piece, we've talked about it even on the podcast so many times before in previous episodes. But the other side, the medical training piece, particularly now when you're saying with the specialty of dermatology and beyond that, really there are gaps that we still need to close. I mean, you mentioned you're fortunate enough to have been trained in urban areas where you had a level of exposure, different populations, different communities. Not everyone gets that. And it is so important.
Yeah.
Let me, I want to switch gears now, thinking more inside out health, another area of specialty for you, longevity, metabolic. I'll call it metabolic makeover if I could call it that way. And just along those lines of thematically of integrating that all together, your practice, as I said, is more than just dermatology. It's aesthetics, metabolic health, longevity. What connected those dots for you? What brought that together?
They're all related. As we're aging, we're living longer. Patients want to maximize the quality of their lives. And that intersects with how they look, how they feel, and what they can do to maintain that for as long as possible. So it was a natural, marriage of these elements to provide them with the best possible care. And, as a cosmetic dermatologist, I'm always counseling on how patients can slow down the aging process, enhance it, and really maximize and reap the benefits for years to come. And I realized that you can't just do it in a vacuum. I can't just be doing injectables like Botox and fillers and lasers. You need to be doing other things to help maximize your body and your skin to be at its prime. So that's why, I talk about longevity, and I talk about, what you put in your body, antioxidants, what we can do to help our metabolic processes. And it's all interrelated. I don't look at the skin as a single organ. It is connected to every other organ, and it has a very visual effect. So if you can enhance what you can do on the inside with maximizing and really honing in and enhancing what you have for your internal health, it will manifest as healthy, really useful.
Saying earlier,
skin.
it's almost a barometer with that.
Exactly.
With the, I see how it fits together, particularly when you even think about GLP-1s and sticking on longevity. There's been so many. I see it whenever I'm online or looking at some social feeds. You think about longevity products, NID, collagen, peptides. Yet how do you help patients sort what I would call science from hype? And I think it's not a stretch to say marketing from medicine.
Yep.
Because it's out there. So when someone comes to you and says, look, I want to optimize, and I've done this myself. I want to not only look good, but I want to feel good inside.
I go based on the evidence-based medicine. So if it's something that is backed by science, there have been studies that have shown some type of benefit, then I think that patients should go for it. However, if it's just hype, someone just making a statement, and there's really no evidence to back it up, I don't see any need to kind of go with that intervention. So it always comes back to evidence. And, for instance, we're looking at the many benefits of GLP-1s. We know that it works for, metabolic syndrome, obesity, helps with diabetes, and it helps with a lot of other cellular processes, cardiovascular health. So we know that it has a lot of benefits, and there are studies to back it up.
Even addiction now, we're saying.
It is incredible.
Seizure disorders.
It is incredible what it does. And I have a feeling that we just only scratched the surface. And there is more evidence to come for the benefits. Same thing with metformin. That is also a very old drug, but we are seeing so many benefits from it. And I treat some of my patients with metformin who have inflammatory diseases, such as acne, hidradenitis, and it also has a lot of metabolic, benefits. And we're seeing longevity from the studies. So, we do see benefits even from drugs that have been around for a long time. It's just now we have the evidence to back it up so that I can recommend it to my patients.
It's really interesting that the common denominator seems to be these metabolic conditions, right? You think about metformin or even GLP-1s, they're for diabetic patients.
Exactly.
And, that there's a tell in that, right?
100%. We know that metabolic syndrome, it stems from, being sedentary, being obese, and that leads to hormone disruptions. And those hormones are chemicals that are going through your whole body and have effects. Right. And if we don't control them, that's what leads to these imbalances and can lead to a lot of health problems.
Yeah. Let me, on the GLP-1 side, I think this comes up so often, and we see this again. I hate to keep bringing up social media. But with respect to what's happening to the skin clinically and aesthetically, when people rapidly lose weight with GLP-1s, what do you do both clinically and empathetically to treat things like, I would assume we call it Ozempic face?
This was such an unintended consequence that we saw from the GLP-1s. People were losing weight rapidly. They were feeling better. The diabetes was clearing up, but they noticed that they were looking older. They were looking hollow. And we found that not only because they're losing weight rapidly, their fat pads in their face were atrophying or getting smaller, but the actual GLP-1s actually have an effect on the skin that's preferentially targets like facial fat and its elasticity and collagen. And that accelerates that aged appearance. And that is what we call Ozempic face. When we saw this phenomenon happening, we actually got bombarded with many patients who were coming in with the same issue. Hollow face, they were looking older, and they didn't want to go off their GLP-1s because of all those benefits that we just talked about. They were feeling great. They were off their medications. They're not taking blood pressure medicines or diabetes medication. They were feeling great, but they weren't feeling great about how they looked.
Yeah.
And their faces especially, because, they almost looked sick. Some of them looked so gaunt. And what we found as a community of cosmetic dermatologists is that we can use the science to help these patients look better without sacrificing the benefits of being on a GLP-1. So we were looking at a variety of ways to replenish volume. So one of the key treatments that we did was biostimulation, using biostimulatory fillers such as Sculptra or Radiesse to really help build up that reservoir of lost fat and really help to make patients look more healthy and restore those fat pads. And, we were combining with hyaluronic acid-based fillers, light and energy-based devices to stimulate collagen, using growth factors, PRP. So a variety of different modalities to help enhance volume, help with skin integrity, help with skin tightening so that patients could enjoy the benefits of their GLP-1s while also looking good.
Yeah, that is a great segue to our next segment. And, Joe, our producer, and I often say we can't go through a podcast without also addressing the markets, capital markets, venture capital, and innovation. Mm-hmm. And there's a lot happening out there, also on the regulatory side with scope of practice laws and other areas. Let me start with this. We're seeing a surge in subscription-based skincare and direct-to-consumer dermatology, really online. I mean, a lot of this, I don't know how regulated or not regulated it is.
Yeah.
How does this shift both access and expectations? And are you seeing this in your practice? I mean, either the demand for it or folks who've come in and said, oh, I go online for that.
Yeah, we're seeing a lot of it. And especially for conditions such as acne, hair loss, and, a variety of other skin conditions. Who are they getting treatments from? That is the question. I don't know who these people are that are providing these recommendations. Is it just based on an algorithm? Because people are filling out these questionnaires. Are they really seeing someone? There are platforms where you just, filling out a questionnaire and there's an algorithm and it just kind of spits out a regimen that's kind of generic.
And a prescription.
And
right?
a prescription, yeah. And I feel like that is a scary, slippery slope because these patients, are not being properly evaluated by a professional who is trained to treat those conditions. We are also kind of seeing a one-size-fit-all kind of treatment model, which may not be appropriate for their skin, may not be treating the skin properly or making it worse. Many of these patients who bring up that they've used these subscription models have kind of come in frustration because their treatment has failed. They're not seeing the benefits, or in fact, it's getting worse. And now they're seeking help. So, and sometimes I have to reverse some damage. Like some patients, like they were using an inappropriate medication and it actually harmed their skin. So I am always of the mindset that you get what you pay for. And with a dermatologist, there is a standard of education and training. And we took an oath. we need to make sure that we help our patients and not hurt them. And these online companies, I mean, they don't have any regulation. It's really sketchy on like some of the platforms and what my patients have said. And, many of these patients have wasted hundreds, if not thousands of dollars on some of these subscription models with no benefit.
And even, I mean, I've heard about this myself in different communities, states that I've lived in, folks having parties where it's come over and we'll do an injection party, a Botox party. No compliance, no oversight, no even understanding of whether this person is qualified or whether what they're injecting in your face is something real.
It's wild, some of the stories that I hear. Professionals who aren't even trained, like medical assistants injecting. They're also getting product from overseas that may be counterfeit. So we've seen that. There was a case in New York, counterfeit Botox being used. Fillers, everyone thinks that, it's just a filler, but there are dire consequences that can occur. People can go blind. People can get skin necrosis. There are a lot of nuances. That's why we go to medical school. That's why we do years of training. The anatomy is complex. It's not just sticking a needle, because there can be very serious consequences that can occur.
Yeah. Let me shift more deeply on the kind of the venture capital, PE, private equity side. Yeah, I think of it as technology plus incredible exponential scale, great returns, equals a really good investor climate and a lot of interest.
Yeah.
A lot happening out there across the board. The aesthetic medicine market growing super fast. It's going to hit, I think, 136 billion in the US by 2033. From your perspective, what clinical and consumer trends are really driving this? I mean, I could think of some off my mind, but you're an expert here. What's driving this incredible growth? And by the way, I look at this a lot. It's one of those areas in not only clinical medicine, but you don't need much clinical validation if you're doing a private equity pitch or working with a startup. If they're going down this road, if they've got something good, there's probably going to be some traction.
Yeah, I mean, with the rise of the med spa, I mean, we've seen an exponential growth in this in the past decade. And, with the scale, they can attract patients at a very good price point and still make a considerable profit. And they have the scale to also market direct to consumer. Like, they're flooding your social media and bombarding. Like every other week, it seems like a new med spa pops up. And patients really are just very fickle. They see a deal, they see a Groupon, and they just come. And it's kind of scary because they don't really do that much research, and they are really drawn to sleek advertising and the basement bottom pricing, and they're attracted to that. And like I said, you pay what you get for. You don't know necessarily what you're getting sometimes, and the level of training of who is doing the procedure. And that is such a big thing. I mean, in terms of the aesthetic landscape, we see that patients at med spas have a lot of complications. I see them weekly in my office. Weekly. And it's even at some reputable places, but the med spas, for sure, like burns from lasers, number one thing I see as a complication. And, these are usually skin of color patients. They had a treatment done by someone who's not experienced, used the wrong technology, and boom. And that is serious because it can cause long-lasting pigmentary changes, scarring.
It only takes one time.
It only takes one time.
Right?
And then same thing, like I was talking about the injectables, like one wrong move and you can get blinded. You can have skin necrosis, and that is sometimes irreversible. So I think that, these consumers just aren't really doing the research they should be. There are some really savvy consumers who will do research. They will only see, board certified dermatologist or plastic surgeon for their treatments. And I applaud them because they at least know there's a minimum level of training, and, they're going to be playing by the rules. But these med spas, it's like the wild, wild west, and it's scary. And I see complications all the time. And it makes me so upset because I really do think it's due to greed and they're not really thinking of their patients.
These are clinical procedures. I mean,
Yeah,
they're
they
not,
are.
It's, I mean, even if it's an aesthetic injection, it is still when you're putting
Botox.
something right.
Botox is botulinum toxin, so like you can
Wrong spot, that's it. Yeah.
Yeah.
Wow. One other shift. We've got to talk about technology, and I want to go down the as I have to in almost every podcast, the AI rabbit hole. Are there diagnostic tools, advances, AI that is now being applied in, let's say, real world dermatology, aesthetics, even the longevity side, that we look at actuarial tables or algorithms that are really leapfrogging some of the outdated norms that you worked with?
Yeah, I mean, there are a lot of AI-driven devices that are using image-based technology to diagnose patients because, as you know, dermatology is a very visual field. And, you know, the thought is you can train AI to recognize these patterns and potentially make diagnoses. And they've been using it especially for like pigmented lesions or, you know, trying to determine if this, you know, this is skin cancer or not. And we are seeing that, you know, although there is some benefit to it, there is also a lot of discrepancy.
Right.
So it's not perfect. And I have seen advertisements for primary care to start, you know, screening patients with these tools. And I don't think it's a bad thing because we often hear about access being an issue, especially for dermatology. Like people are having 6-month waits to get in. And, you know, sometimes you can't wait that long, especially like if you're concerned about skin cancer. So if we are able to equip, you know, primary care providers with tools that can help them, but also having further training, like in how to do a skin exam and do an assessment, and referring those patients that are high risk to the dermatologist, I think that's a benefit to society. Like I can't tell you the number of patients I see are like the worried well. They really don't need to be in my office for a skin check, but they're there every year and I'm happy to see them, but they're low risk and they really don't have anything going on with them. So I'd rather see people who have acuity issues. Hey, this is a skin cancer, treat them and, you know, be done with that. And I think that that could be a possible benefit for the future, but AI is not there yet.
Right. But it's probably two ends. I think, you know, first with the access piece with primary care, and I really think there's probably is a role there for a primary care provider to, you know, leverage some advanced technology to help them with you know, some differential diagnosis where at least if it has the sensitivity, specificity to a point where, well, I'll be cautious and refer, it's certainly better than directional and going to keep you out of trouble. On the other end, there's probably a lot of high-end technology that you could use just not only the aesthetic side, but I would think in the reconstructive side that are coming, that must see all the time.
They actually have programs that are AI driven, like say you have a cosmetic patient and kind of focusing on the areas where there are, say, certain deficits or defects or certain areas that can be enhanced, and they can do a model of what can be done, how they would look, and you can customize your treatment based on that. So that can help with that consultation and kind of showing the patients what can be done. And on the reconstructive side, so I'm a Mohs surgeon, so I do skin cancer reconstruction, and there are programs that you can take a look at a defect after the skin cancer is cleared with Mohs surgery. What are the options for reconstruction? And they can actually look at the lesion, give you the different possibilities, what's going to be the best possibility, and you can help educate that patient and being empowered with that knowledge to make a decision that can have a serious consequence on the reconstruction.
Oh, it's amazing. I'm sure much more to come on the technology side. I want to close up with a couple of questions. One, I'll kind of say is for you, and one will be for the benefit of our listeners. The one for you, if you could redesign how healthcare, how the health sector treats your specialty of, let's say, dermatology, aesthetics, longevity, where would you start?
That's a great question. I think that there is a misperception of dermatology that we're just simply pimple poppers and, you know, just injecting Botox, very superficial, not real medicine. And that
reinforced by the media, by the way.
yeah, and in the House of Medicine too, like we're always knocked on, like, hey, you're not real doctors, or you guys are out like playing golf like half the week, you know, and it's just that stereotype. And I think that there is a lot of serious skin disease that is out there, and there's just not enough information about that. And I think a lot of patients are suffering in silence. So I think that showing the wide breadth of what we do as clinicians in dermatology, I think would be very helpful, so that I'm not asking for more respect from other specialists or the public, but just to really showcase that we can really help patients with really serious disease. And we are the experts at hair, skin, and nails. And we can really help enhance patients' quality of life, whether it being medical, surgical, cosmetic. We do it all.
Yeah, and as I said earlier, being the barometer with skin is the largest organ of so many other issues. Okay, for our listeners, what's one skincare habit or even, I'll say, mindset shift that you believe could or would make the biggest difference for our listeners today?
It sounds cliche, but wear your sunscreen.
There you go.
And honestly, this simple task will save you so much money from aesthetic standpoint. You're going to slow down the aging process because the sun really does prematurely age you. And second, it's going to help prevent skin cancer. I love doing skin cancer surgery, but if we can prevent that, that's way better.
Fantastic. Dr. Husain, thank you so much for a fantastic podcast. So much information. I know our listeners are going to benefit from this. Powerful stories, fantastic prognostication with respect to where things are going. And also the notion, the idea that, you know, the skin really is more than just, you know, what we're looking at, skin deep. So for our listeners out there, what's your skin story? Drop us a DM, call in to the show, drop me an email. We'd love to hear about that and feature it in an upcoming podcast. So for now, thank you from the Healthcare Nation podcast. Thank you, Dr. Husain.
Thank you. It was a pleasure.
The opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.